everyone, welcome back to our channel. Today we're going to talk about non-surgical options for fat removal. I'm doing this video just because we got a lot of interest from the Aquilix Velcera fat dissolving injections video and also the Brazilian butt lift video as well. There was a lot of interest in body contouring. I got lots of questions about different options and this is one video that I hope will address some of these, and I'm more than happy to make a few more in the future about anything that I haven't covered here, or if there's anything you want to go into in detail. So before we get started, if you're new to our channel, welcome, and if you are a returning visitor, welcome back, and thank you so much for your support. If you haven't done so already, please don't forget to subscribe to our channel and check us out on social media, particularly Instagram, where we showcase a lot of our work, and Facebook as well. So what are the options for non-surgical fat removal? So before I answer that question, I'm just going to quickly tell you what the option is now, and I'm going to caveat this video a little bit. Whilst in my career I have experience of performing liposuction and some non-surgical alternatives, this is not something that we do in the clinic. I'm by no means an expert in this, but I am very evidence-based, and I do like to provide a whole list of alternatives for our patients when they come for treatments that we don't offer, just to give them an intro and direct them in the right way. And I hope you, our viewers, also appreciate this. At the moment, the options for fat removal, surgically it's liposuction. It's a procedure that involves putting fluid into areas where are the cells, and this fluid kind of helps as you put a probe in there and you basically move it around this needle. It's a large cannula even, and you suck the fat with it, and this can be in smaller areas syringe assisted, so there's a vacuum and you're sucking the fat cells that you've loosened up with a fluid in there. Or in larger areas, sometimes people use vacuum assisted lipo, and that just allows the procedure to, be bigger, remove more fat more quickly. Liposuction has been around for a long time. It's a procedure that can get the most dramatic results, and it's often used in combination with body contouring. So for example, people might have fat removed from kind of maybe the waistline area, the back, maybe the thighs, and either that's kind of discarded or it's combined with body contouring where the fat is then injected into somewhere else, most commonly these days in the buttocks, to try and kind of get more of a curvaceous figure. But it's also used in reconstructive treatments. So sometimes when people have had cancer and they need reconstruction, some fat may be removed and put in the area where the cancer was removed to build up the defect. So these are kind of just a quick whiz through into liposuction. It's hugely effective, but it is an operation, and it does carry risks. So smaller areas of liposuction can be done under local anesthetic, but to be honest, a lot of liposuction, particularly the bigger areas, is often done under general anesthetic, which means they put you to sleep, and that carries some risks. The procedure itself, large volumes of liposuction can cause huge shifts in the body's fluid balance, and that can lead to horrible illness, sometimes very rarely death. But that can happen. So this is something, not to scare anyone, this is incredibly rare, but these are, to make a point that whilst this is usually an aesthetic procedure, nothing is without risk, and it's important to go in informed with that. And this is why, if you are considering any of these procedures, make sure you see someone who is qualified and experienced and can do everything they can to reduce the risk of anything bad happening. So liposuction itself can be performed almost anywhere in the body, but it's less ideal for places like the face, but it's quite good in the hip, the waist, the buttocks, the back, even the neck. You get good results with that. There is a lot of downtime with liposuction. So after the procedure, people often have to wear compression garments. The recovery can take commonly something like 6 weeks for all the swelling, the bruising, the pain, the tightness to go down. So you don't see immediate results, and you may feel terrible afterwards. And that's, again, like a lot of aesthetic surgery, but it's important to remember that this is part of the process. Most people only need one procedure. They may need a small revision or touch up later, but it's usually a single procedure, and the results are permanent, although obviously doesn't stop you from putting weight anywhere else. Like all of these procedures, it's better that you have achieved your ideal weight through natural weight loss before attempting them, but liposuction can work even in people who have not worked out to reduce the weight to where they want it to be. So the alternatives to liposuction, and I'm going to mention non-surgical, but that they vary. Some of these are invasive, some of them are not invasive. And I'll start with kind of the lesser invasive ones and work up to the more invasive ones. So the big one that you may have seen lots of adverts for is coolsculpting. So coolsculpting involves basically placing a device into the area where fat loss is required. And then the fat cells in that area are frozen to a point where they basically die, and then they break down the fat cells and they're absorbed by the body. Coolsculpting is great. It's non-invasive, so for anyone who's not looking to have surgery or even injections or anything, it's fantastic for that. There can be pain associated with it. It does vary from person to person. Often, like most of these non-surgical approaches, coolsculpting needs a course of treatment usually, and that's something you have to bear in mind. It's not really good enough to go once. It is expensive, but not as expensive as liposuction. Most of these procedures aren't, but it's worth bearing this in mind. So coolsculpting is great. It's from Allergan, and they are the same makers. They make Botox, they make Juvederm. It's a very reputable pharmaceutical brand, and so coolsculpting has been quite popular for this reason. There are limitations. So coolsculpting is not going to obviously give you the results of liposuction. It's good if you already have your ideal weight. It's not great for large areas of fat loss, but it's good if you have stubborn areas. Maybe it's a little bit of a belly that you're really having some belly fat that you're having a hard time getting rid of, or it maybe bits of fat in the hips or kind of in the neck area. So it's good for very targeted small areas, and you can get decent results with it if you follow the advice of your practitioner in terms of how many treatments you're going to need. The next one that is related to coolsculpting is TrueSculpt, and TrueSculpt works in a similar way to coolsculpting. However, it uses radio frequency energy to break down the cells instead of freezing the cells down. Both procedures require a course of treatment. Both of them are non-invasive, but that doesn't mean there isn't any swelling or pain after the procedure. Both of them, the nice thing about it is there's very little downtime, and people can notice the results relatively quickly, especially if you've completed the course of treatments. You don't have the same kind of downtime, bruising, and the same swelling that you do with laser, so you often see the outcome much more quickly. Again, the same kind of caveats. They're better for targeted smaller areas of fat reduction if you're happy to have a course of treatment, and they are much cheaper than obviously liposuction. The treatment, though, does depend on how your body responds to either the radio frequency of the coolsculpting, so it's important to kind of bear that in mind, that results can vary from patient to patient, and they absolutely, both of these should be something that you do after you've reached your target weight. They're also really not very good if you have loose skin. So if you're someone who has anyway tight skin, but you've got kind of maybe a little stomach pooch or some specific area or the neck that you want to do something to, but the skin in that area is nice and tight. Otherwise you'll have sagging skin if the fat cells kind of go, but the skin is sort of hanging there. So that's another important thing to consider. After this, we kind of get into the invasive but not surgical options. So the big one that's quite exciting, to be honest, is BodyTite. So with BodyTite, it delivers radio frequency energy, which kind of injures and destroys the fat cells, and then the fat cells are kind of broken down and removed by your body. So that's with the probe that goes inside. It's invasive in that something goes into your skin, but it's a small probe that goes through a tiny, tiny puncture wound, a tiny hole, rather than kind of a big area. The good thing about BodyTite is there's also on the top of the probe, above the skin, a second component to the treatment. The external applicator delivers radio frequency energy, which tightens the skin and stimulates collagen production. So this is really good for areas where there is fat, but you're also looking to tighten the skin around that. So BodyTite is really good for that, compared with coolsculpting or TrueSculpt, which doesn't really address the issue of loose skin. With BodyTite, there is obviously downtime. It is a procedure that does involve a probe going into the skin, so that's something to consider when you're considering this treatment. Usually only a single treatment is required, but again, it's worth talking to a practitioner if it's a particularly tricky area to address. The nice thing with BodyTite is actually it can also be used to target particularly tricky areas like excess fat and loose skin in the face or the neck, areas where liposuction sometimes struggles with. So that's a really cool use of BodyTite. So that's BodyTite, and it's exciting. And I will leave a link to some of these treatments and to the British Association of Body Sculpting, which I'm also a member of, and they have lots of really interesting information about this. The last two that I'm going to mention are laser lipo. Two good examples of this are SmartLipo and Sculpting. So these both involve having a probe that goes into the skin, and it uses laser to basically remove, to kill off the fat. They can also suction a tiny bit of the excess kind of melted fat, but a lot of the fat cells will be done away with by your body. Both these are a really good non-invasive option, but obviously they are a bit more invasive than coolsculpting, as I mentioned at the beginning. And they are procedures that do have a bit of downtime with them, but they are effective. And again, they're really good for areas where they're not particularly large areas, but areas where there's stubborn fat. And so with the laser lipo options, results you can see more immediately, so it takes less time than liposuction, which can take up to 6 weeks. It's been a little bit of a whiz through into an area that strays a bit from Botox and fillers, but it is part of aesthetics. I really like the idea that we can discuss anything aesthetics related, and particularly the evidence behind it, and issues around safety and how to really make the most of these treatments and stay safe and get amazing results that are within the limitations of that treatment. Let me know what you think of this video, and if you'd like to see a little bit more about non-surgical or even surgical cosmetic treatments. If you have any questions about non-invasive fat removal, please leave a comment below. And if you haven't already done so, please don't forget to subscribe to our channel, give this video a thumbs up, and hit the notification icon. Until next time.